All right, guys, welcome into today's lecture. Today we're going to talk about Chapter 21, Heat-Related Emergencies. So, to understand heat emergencies, we also need to understand how our body regulates body temperature and releases heat, okay? The body is constantly trying to maintain body temperature like we talked about in Chapter 20. As far as heat goes, it's trying to disperse heat so that it doesn't overheat. If you don't get rid of excess body heat fast enough, damage to the brain and other vital organs can happen. The body disposes of excess heat a couple of ways. The two most important is evaporation through sweat and radiation by losing heat to its surroundings when the air temperature is below 70 degrees. Once the air temperature is higher than 70 degrees, radiation is out of the question. Okay, we're not able to use it. Again, as environmental temperature approaches the body's temperature, heat loss through radiation decreases significantly. Okay. Another thing to keep in mind when it comes to heat loss and heat production is water loss. Water makes up to about 50 to 60% of an adult's body weight, and about 2 quarts of water every single day are lost through breathing, urinating, bowel movements, and sweat. So, you have to make sure that you are drinking 2 quarts of water to be able to replace water that is lost. That's a quiz question. Make sure you understand that. So, an adult requires about 2 quarts of water a day. A working adult can produce 2 to 3 quarts of sweat in an hour. So when you are working, you do need to drink more water, okay? When you are thirsty, you are already dehydrated. Now, I do, this will kind of be a theme throughout this chapter. You need to understand that a lot of newer research has shown that drinking when you are thirsty is enough to keep you hydrated enough. Okay, now it's not talking about performance for athletes and things like that, but as long as keeping you from being unsafely dehydrated, drinking when you're thirsty is enough. So you do have to be careful because overhydration is a possibility and is a problem. And we'll talk about that here in just a few. Make sure you remember that an adult requires about 2 quarts a day of water to maintain hydration. So, in order to monitor for dehydration, monitor urine output. How often are you urinating, or are your patients urinating? What is the color of the urine? Is it really dark? Is it lighter? Those are some things to keep in mind. While working outside in hot weather, you need to drink about 8 ounces of water every 20 minutes. And you want to avoid things like caffeine or alcohol, soda, and fruit juices, as they do not hydrate you near as well as water will. Electrolyte loss. So potassium and sodium are essential electrolytes. They are found in sweat and urine. These electrolytes are used to control movement of water in and out of cells, so they are necessary. If you run out of electrolytes or you run low on electrolytes, it will contribute to dehydration. Okay. So water intoxication. Another name for this is hyponatremia, which we'll talk about more. But if you drink more than 1 quart of water an hour, it can lead to water intoxication, can lead to profuse sweating, and you lose electrolytes fast. Okay. Some symptoms, so this is like the precursor to hyponatremia, which we'll talk about later. Some of the symptoms are frequent urination, behavior changes, weight gain, and edema. The other thing we have to take into account are the effects of humidity. Sweat can cool the body if it evaporates, but in high humidity, sweat cannot evaporate. It just sits on your skin. At about 75% or higher, the sweating then becomes ineffective. Higher the humidity, the lower temperature at which heat risk begins. Okay? So people who are at risk: obese people, people with chronic illnesses, people who have alcoholism, older people, infants and young children, children and pets left in parked cars, and outdoor laborers and athletes are at an increased risk of heat illness. So, certain medications can predispose people to heat stroke. Anything that alters sweat production or that interferes with thermoregulation. There are medications like diuretics that cause you to urinate more, that can dehydrate you. Those are some other things to keep in mind. So heat illness is kind of a broad term. It does include a range of disorders. Heat stroke is the only life-threatening form of heat illness, meaning that if you do not treat heat illness, if you do not treat heat stroke, the patient will die. Other conditions, if left untreated, will resolve without death, but they can lead to other complications. So the first type of heat illness we're going to talk about is heat exhaustion. Heat exhaustion, some things to watch out for. It's going to be characterized by heavy perspiration, so a lot of sweating, and you're going to have a normal or slightly above normal body temperature. Typically, it affects workers or athletes who do not drink enough fluids. Some symptoms of heat exhaustion is severe thirst, heavy sweating, fatigue, headache, vomiting, or diarrhea, and or flu-like symptoms. Heat exhaustion is different from heat stroke because the person has no altered mental status. Their skull may be clammy, but it's not hot. So, like I mentioned with cold illness, that line that we're looking for from when heat illness becomes really dangerous is altered mental status. If the person is still with it mentally, they've not entered heat stroke just yet. But you do have to be aware of that person and treat it now so that it doesn't turn into heat stroke. Untreated heat exhaustion can turn into heat stroke. As far as what to look for, some other things: pale or ashen skin, clammy or sweaty skin, but it's not hot, severe thirst, fatigue, dizzy, shortness of breath, or rapid heart rate. As far as what to do, move the person out of the heat to a cool place. Try and remove any excess clothing. Spray or douse cold water on the person's skin and fan them vigorously to get some airflow. If the person is able to swallow, give them a commercial sports drink, fruit juice, or lightly salted water to get them some more electrolytes. But do not give them straight salt tablets. Okay? And then if it's really severe and the person is not recovering quickly, call 911. Now we're going to talk about heat stroke. So a couple of things to keep in mind with heat stroke: there are different types of heat stroke. Okay, exertional heat stroke is very quick. It happens in the hot weather, usually with activity, whereas classic heat stroke takes a long time to develop and is usually associated with a medical condition. So heat stroke, you should suspect heat stroke if the person's body feels extremely hot, so their skin feels really hot. If a person's mental behavior starts to alter, that's when we're going into heat stroke. A coma can occur in less than an hour, but taking a rectal temperature, so a thermometer up the person's rectum, is the most accurate way to distinguish heat stroke from heat exhaustion. Now, a normal adult, a normal first aid provider, is not going to use a rectal temperature. You don't have access to it. Not everybody has a rectal thermometer in their car. That altered mental status is what is going to show up for you guys as the line of heat stroke versus heat exhaustion. Other things to look for: the skin is going to be extremely hot when touched. It's usually going to be dry. That's because when a person moves into heat stroke, they stop sweating. Okay. Again, altered mental status, flushed skin, they're going to be red, have flu-like symptoms, and they're going to feel like they're burning up, like they have a fever. As far as what to do, move the person to a cool, shaded area. With heat stroke, you are going to call 911 because this is life-threatening, and you're going to cool the person quickly as possible, by any means possible. In athletic training, we use what's called whole body cold water immersion, which is the most effective. We are dumping the person in a ice bath. Okay, there is a chance that they may not be conscious, which means we have to hold them up. But we are going to dump them in ice water to cool their body down as fast as possible. The other way you can do it is with evaporative cooling, meaning you spray the person with water like they're doing here, and somebody vigorously fans the person, and then you place ice packs against the person's head, armpits, groin, or sides of the neck. But whole body cold water immersion is the most effective means. Stop cooling the person when the person's mental status improves. As soon as they start to become with it, you're good. You don't need to keep cooling them down. You have to be careful because you can overcool somebody and actually put them into hypothermia. So you do have to be somewhat cautious of that. Monitor the person frequently. Continue to check their pulse, their breathing. Try and talk to them to see if they're with it. And again, call the person or call 911 as soon as possible. Another heat illness to be aware of is called heat syncope. Heat syncope just means fainting. So dizziness or fainting that can happen immediately after strenuous physical activity in a hot environment. Okay. Heat syncope happens often with heat stroke, but you don't have to have heat stroke to pass out. Okay. If they're unresponsive, check for their breathing. If the person failed, check for any injuries. Have the person rest in a cold area. If they come back immediately, they probably don't have heat stroke and they're probably fine. If they do come back immediately, if they take time to come back, then we're really worried about heat stroke and we're going right into cooling them down as soon as possible. Again, if they come back immediately, we can just wet their skin down with a cool cloth or a spray bottle, remove excess clothing, give them lightly salted water or some commercial sports drink. The next thing, heat edema. Heat edema is swollen ankles or feet that happen during the first few days in a hot environment. Happens a lot with people who go to, who travel, go to hot places, and they're not used to it. Have the person wear support stockings or compression socks, and elevate the person's legs when stopped. Heat rash, it's an itchy rash on wet skin from sweat. Most often seen in humid regions after prolonged sweating. As far as what to do, dry and cool the person's skin as much as possible, and then try and limit their heat exposure. So the last thing we're going to talk about is hyponatremia. Okay, I mentioned this a little bit earlier. Hyponatremia happens when the balance of electrolytes and water is not there. So somebody is out of electrolytes, but they have an excess of water. The body is not able to use the water, and the person effectively drowns. Okay, so if you drink too much water, it is very dangerous. I attended a discussion last year where they talked a lot about this. You do have to be aware that preventing heat stroke and dehydration is not just drink water, just tons and tons of water. Okay. The other thing to talk about is heat cramps. Just drinking tons and tons and tons of water is not going to keep heat cramps from coming up. And I thought we talked about cramps in this, but apparently there's no slide for it. So anyway, we'll talk about it a little bit now. A cramp happens when you have we did talk about cramps in another chapter. That's right. Okay. So cramps can happen, but that doesn't mean that just drinking water is going to make them go away. And I talked about this before. If you overdrink, you can die. If you don't drink enough, your chances of dying are very low. You may have some symptoms, but you're probably not going to die. Okay. Some things to look for hyponatremia is a person has drank a lot of water. They may have sweaty skin. Their urine's going to be very clear. But when they start to have this altered mental status and systemic symptoms, that's when we need to be really worried. So they're dizzy, weak, nauseous, vomiting, or have headaches. May feel very bloated, an altered mental status, seizures, or unresponsiveness eventually. As far as what to do, move the person to a cool location. Give them salty foods. Do not give them more salty liquids. Okay? Don't give salt tablets, and do not give fluids. If the person is starting to have an altered mental status, call 911 as soon as possible. Make sure you understand these. They're a quiz question. So if you'll notice, some of the symptoms on the last slide are pretty similar to dehydration, okay, or to heat exhaustion, those types of things. So the biggest difference is if this person has been out in the heat and they're having these symptoms, but they've been drinking a ton of water, chances are they're not struggling with dehydration. They're either struggling with just regular heat exhaustion, or they're having some symptoms of hyponatremia. So you need to be careful. Just drinking more water doesn't take care of heat exhaustion. You need to get them out of the heat. Okay, so be aware of those things. Again, this is a quiz question. Make sure you know how to treat somebody with hyponatremia. Okay. If you have any questions, please reach out. Be happy to answer any of your questions. And we will see you guys next time.